So if we think about the future, then there's a need expressed for the ability to tailor therapeutics by the individual as opposed to being limited to population-based statistics. What we've seen is that statins confer a large benefit on a population level, and we've made great progress in the field on the basis of their use. In order to go deeper, though, we know that there are an increasing number of other drug classes which could be given. However, for a variety of reasons are not given, whether it be because of cost or be because of side effects, by giving those patients to non-responders. So the ElucidVivo's scientific roadmap is moving forward to provide ever more increasing granularity so that we can get down to trial sizes, if you will, of the N of 1 and individualize the patients. This has been popularized in the popular mind as precision medicine, largely associated with cancer. However, what we'd like to be able to do is to also make cardiovascular patients benefit, provide that benefit to cardiovascular patients with techniques which apply to the specific requirements of cardiovascular disease. A large part of that, of course, being that you can't biopsy the plaques. And that's a big difference with oncology. So what we're looking for are non-invasive methods in order to do that. And that is what the ElucidVivo is increasingly able to provide. If we look how we're approaching the issue, the first is high fidelity image processing. And in particular, we've already seen results in image restoration, for example, to increase the signal to noise ratio, despite technical and other characteristics of the images, which unprocessed are suboptimal. And then we've discussed the histologically validated plaque tissue characteristics and phenotyping, which is made possible by that. And Dr. Budoff has reviewed a couple of the specific examples that we've done in some drug trials in terms of the benefit that that brings. Now what we have started to publish on as of this May in the ATVB is non-invasive expression profiling. This takes it down another scale or deeper scales for a multi-scale analysis from the macromolecular presentation at CTA down into the cellular and molecular level activity, which is undergoing in a particular patient. So specifically, if we start with the image processing, move to the phenotyping, and then apply these techniques in such a way as to get the expression profiling, ultimately what we are able to consider is the opportunity to have an accurate description of the dysregulated biological processes that can allow for determination of what different drug classes that patient would be most likely to be able to respond to. The dominant mechanism of the plaque phenotype then can be used in order to achieve the goals of precision medicine in cardiovascular disease.